Thank you very much for coming this morning. I'm very pleased it's saddened in some ways that the Federation has to go to such extraordinary lengths, but essentially we want to see action in relation to the prevention of violence and aggression in our hospitals towards our nurses and midwives across the state. This isn't just a metropolitan issue, it's an issue for our regional Victorian members as well. We have had a task force with a number of recommendations. We've now had a parliamentary inquiry which also provided recommendations back in December 2011, but we see little or no action. Indeed, the government's most recent response to its own inquiry was that it supported the recommendations but refused to assist hospitals in relation to funding, particularly for key outcomes around security personnel. The Baillieu opposition and now Napthine government promised $21 million for security personnel in our hospitals, and essentially we have seen none of that money. We know that health professionals, both the ANF as well and the AMA, don't want to see those security personnel armed, and its own inquiry supported that. But because for some reason we have seen no funding dedicated in any of the budgets that have come from the state government in relation to keeping this important election commitment. We have seen additional funding for duress alarms and some training. However, we know that that is simply not enough. It is no point pressing this duress alarm when there is no one there to come and support and de-escalate the violent situation that's taking place. The acts are not limited to emergency departments or our mental health units. They're across our general wards, our maternity units, and today I have two very brave nurses who have agreed to come along and tell their story. We know that nurses are being encouraged strongly to take paid special leave by hospitals rather than reporting the incident officially and through the independent regulator. And the government recognised as well that there is under-reporting of violence and aggression in our hospitals. So we've had, I think we're saying enough is enough. We want action, we want leadership. We're particularly concerned when we see that the state government has started up yet another committee, and when we look at the papers and see what that committee is, the work that it is doing, the first question that it asks of itself is what are the key issues in relation to violence and aggression in our health system? That question has been addressed time and time again, and what we need is action, not another committee. We don't want to see more recommendations that will sit on a shelf and gather dust. We are concerned with the increasing demand on our health system and the pressure that's being put on our nurses and midwives in that system, that we actually have to go to the length of a extraordinarily serious injury or indeed someone being killed, and then we will, people will say, well, what should we have done? We know what needs to be done. The experts have told us what needs to be done. We want action. We want leadership from the government to coordinate the implementation of the recommendations, fund them where they're necessary. Don't provide more duress alarms and training on their own. We need a really comprehensive approach and one that will actually prevent and be an active one.